Okay, thanks for inviting me. What I'm going to be doing with this really is to highlight some patient and clinician stories which we've recorded. We've been working with an organisation called the Medics Academy, where we kind of produce videos to help clinicians in terms of using digital. So what this is about is around how we've been using Facebook in the West Midlands, in Staffordshire in particular, at the Royal Stoke Hospital. And by way of a backdrop, in North Staffordshire, we've been doing quite a bit of work over the last couple of years around using Facebook in primary care. So we have a really good ability to be able to put information out across GP practices. So out of the 83 practices, we've currently got 60 who are using social media, and that gives us a great opportunity to recruit patients in terms of getting them to groups or events and things like that. We've also got a growth of closed groups, so we do a lot of work with PPGs, patient participation groups in GP practices. So again, closed groups, bringing patients in who can then sort of interact, and those people that can't get there for face-to-face meetings and things like that. And then on the back of that started where we developed around support for patients with long-term conditions, and there were two reasons for that really. One was around creating an environment where patients can interact, and patients can meet other patients who are going through the same experience. And when you often talk to a patient, whether they've got diabetes or other conditions, often the only people that can really understand what they're going through are the people that have actually got the same condition. So we often get requests for sort of patient groups. Can you do some training with us so we can create an online group where we can sort of interact with each other? And the other reason really is that there is a growth of Facebook patient-generated groups. And the difficulty with those is there's no control over how they're moderated and no control over what the information is that's circulated in there. So previously when I was working with the CCGs up in Lancashire, we've got examples of stress and anxiety groups and other groups up in Lancashire that have got patients interacting with each other and arranging to meet up because somebody's prescription's finished and somebody's saying, well, I've still got some, we can meet up and you can have some of mine. So this goes on all the time. These groups go on because they're moderated by patients with often have been set up for the right reasons, but you've gotten a very little control over what goes in there. So the first one I'm going to show you, the first video, is an interview with the AF nurse, atrial fibrillation, which is irregular heartbeat, and the impact on stroke. So they work very closely with the stroke team, and then also with the patient, and they're going to talk about how they use social media to support each other.
My name's Jodie. I'm a stroke prevention nurse. My main role is working with patients who have atrial fibrillation and making sure they're on the correct management for stroke prevention. Atrial fibrillation has a 5 times higher risk of stroke, and strokes caused through atrial fibrillation are more severe than any other stroke. Patients who have atrial fibrillation strokes are unlikely to go home afterwards and are most likely to go into long-term care. And I think one of the biggest issues is that patients who have AF potentially don't know that they have AF. I have patients contact me through Facebook Messenger asking me for advice. Patients have even messaged me to ask me for advice on cholesterol and what they should do. And that's saved a trip to the GP practice. So from a cost saving perspective, it has reduced that a little bit. And I feel the patients who use the Facebook page feel confident that if they have any questions, there is a professional, a clinical professional on the end of that message supporting them through the process. I've had patients who have suffered with VTEs following flights, who've messaged me for advice about what they should be doing for their management. So although it is an AF support page, I've found lots of different experiences coming through and lots of different questions, and I feel that we've made some progress in helping that patient to get the best medical advice and management. Patients respond very differently to the Facebook page. Patients are very motivated in managing their own self-care and giving sound advice to other patients. Some patients can be quite negative about some of the new medications used, and you have to be very careful that they're not putting off other users who are using the Facebook page and the management that they're on at that time. So that's something that has to be managed quite soundly. The numbers on the Facebook page have come up quite significantly, and I think one of the biggest surprises that we had was how the older population was using the Facebook page, because you would imagine it to be all the younger patients with the smartphones and the apps. But actually lots of our patients are well over the age of 65 who are using the Facebook page, so it just goes to show that actually smartphones and apps are now being used by everyone.
Facebook, as you know, is a way of sharing other people's thoughts, images and experiences. And people who suffer from atrial fibrillation, stroke or whatever, have their own experience, and the only people who can understand that experience is other people who've suffered the same. You know, all your friends will say, oh, I know how you feel. Unless they've suffered the same type of thing, they really haven't got a clue. They don't even come to the start. So using Facebook, where you can share your experiences and look at other people's experiences, you can gain their experience at the same time. It's a means of inputting yourself, having some input to other people's thoughts, and by means of contacting any of the nurses or any of the doctors, if you have a problem, they can be onto it very, very quickly. Everybody has their own source and their own different way of thinking. A clinician will obviously only be purely their way of thinking, but experiences from other patients are different than what a clinician, because unless he is a sufferer, he only sees it from the medical point of view. Everybody has their own source and their own different way of thinking. A clinician will obviously only be purely their way of thinking, but experiences from other patients are different than what a clinician, because unless he is a sufferer, he only sees it from the medical point of view. There are obviously changes in medicine on a day-to-day basis. New way of testing, new way of different drugs on a day-to-day basis. Unless you're up to date with that aspect of the medicine, you'll fall behind. And life can change, as with me. My life changed by changing the drug. I wouldn't have known about it or done anything about it unless we would have had that input. I've used it on many occasions before, with all my families, on holidays, interacting with people, commenting on other people's experiences. I can see Facebook getting stronger and stronger on this type of subject. It can be used in other aspects of medicine, not just particularly the AF support.
I suppose the difference that these nurses do as well, they have a public page as well, so they're able to promote the work they're doing publicly as well as having a closed Facebook group, so they get the benefits of using both types of Facebook. So within that team, you've got at least 5 nurses who help manage that page and the group, and we've also got a consultant as well who'll lend support as well with advice that goes on there. I mean, one example of that video still there was created by the nurses interviewing the AF consultant, and he was doing a little interview about the impact of AF on stroke, and that got 20,000 views in a weekend when we posted it across all of the primary care pages. So it can have quite an impact, and it helps recruit more people into that group. The other video I'm just about to show now, this is slightly different. This is a cardiac rehabilitation team, so these are more physios rather than nurses. But the patients that go into it have had a heart attack and are on some kind of exercise program, support program, to get them healthy again. So they come from a slightly different perspective, and you'll see from when they talk to you what it's all about. It's around getting information out into the community.
one of my daughters introduced me to computers a long time ago, so I became familiar with Facebook. It was a good idea keeping in touch, and then seeing the cardiac group on Facebook was very good, because there were times when I'm a little bit worried, wondering if I'm doing the right thing, if I'm not feeling too good. Should I be feeling like this? I don't know. But I can put a question up there and ask somebody, and lo and behold, given a little bit of time, both people from the cardiac team and the patients were sort of emailing back via Facebook and saying, oh, well, do this, try that. If you're in pain, phone 99. This was a few months after the initial heart attack, which happened, and I was getting chest pain, used the GCN spray, didn't subside, used it again, it was still there, and so I put a message out on Facebook.
Well, there is a chance that if Dad hadn't have posted that on the group, or the group wasn't there for him to do that he wouldn't have phoned 99, and he might have waited. And who knows what would have happened if he had have waited, because me and my sister at work, we're there for you, but we can't always be really there, and you just don't know, do you? If he hadn't had that ability to post on the group, it could have been a hell of a lot worse, couldn't it? I think that it was probably quite a defining moment there, wasn't it, when you put that message on that wall, because that enabled you to manage your own health, didn't it, then?
Yes, that's right.
And then, a member of staff, in a way, intervened and said, yes, you do need to come in.
Yes.
So that, I don't know, like I say, what would have happened. And that's quite a massive thing. I mean, it's a wonderful thing, Facebook is, and the power of it's phenomenal. And quite often with groups, they are formed by people who aren't medically trained. So you haven't got that confidence, have you, to know that you're getting the right information. But
okay, we set up the page because we felt it was probably something that we were lacking, an area where patients' families could come and speak to us. If the patients' families couldn't attend clinics, then they didn't really have maybe answers to the questions that they needed. So it was a nice opportunity for them to be able to speak to us directly with any queries, any questions, any concerns that they had. It's beneficial for the patients themselves, because they're able to converse with each other, they're able to share their own experiences, how they've dealt with things, how they find things since they've been discharged. And it's nice for patients to see that whereas they might feel quite alone in a situation, that there are other people going through just the same, and they're able to converse with them appropriately. Feedback has been all positive. Patients' families have been quite welcoming that they've had the opportunity to get their questions answered, and I think it's something that if we didn't have the Facebook page there, then they would have been waiting a lot longer to air their concerns and to get the answers to the things that they needed.
We really need our service to be as accessible and as convenient as possible. And we moved a lot of our services out into the community because of that, and worked from a lot of community gyms, but we were still finding that there was a lot of patients that couldn't attend those sessions. So it might be that they had work commitments, family commitments, they might have been completing university, college courses, or were just very elderly, and even making those services closer to home still wasn't accessible for them. So we thought that social media and using Facebook would be a good way of being able to bring the programme into their own home, that they could access it a touch of a button on either their phone or their computers. The team on the whole were very, very keen to take part in the project. We're quite a young team, so we're all very familiar with technology ourselves. We all have Facebook and we all use it. We were perhaps concerned in terms of how much work it would be for us if patients were posting a lot of clinical questions on there, and the speed of us needing to reply to those. But actually what we found over time is that we can be much more of a monitoring role, and patients and relatives answer their own questions and start discussions between themselves, and they're actually very capable capable of doing that, so we don't need to directly answer. Is that we see a lot of patients once they've been discharged from hospital, but there's often a few weeks before they'll actually come into clinic with ourselves, and it's in that time that actually patients and their relatives have an awful lot of questions. It might be that they start to have side effects with their medications, it might be that they've recently been discharged from hospital after heart surgery and they're wondering what they can do at home, and before that we'd often find that patients would be coming into clinic and saying, I haven't done anything for a few weeks, I wanted to wait for this appointment, I didn't know what I could do. And it's really nice having Facebook that actually they're just writing those questions on there and we can answer that immediately for them, and there isn't any delay in their recovery. Then they're able to get out, get active, and do the right things to help them improve their health and to get them over their recent event without that unnecessary delay with it. And that's what's important for us, that we can provide care really quickly rather than them waiting to maybe get into a GP appointment to ask about the medication. It may be something that we're perfectly capable of dealing with within the team, and actually it doesn't warrant a GP appointment. And to be able to answer those queries and to make patients more confident and to reassure them and their families sometimes that these things are normal and they are a normal process of people getting over a heart event has been really useful.
So as Sonia, the nurse who spoke at the end there, talks, they've got very much the whole team support that programme. So they don't just have it around clinical discussions, they also do some quite fun things. They did a lot of fundraising around, they did an event around rowing and how many miles they could row, the staff were, and they had a kind of a regular log of it. It was a fundraising activity and you could kind of see the progress as it went on. It complements an active public page, so they are using the public side as well as the closed group. And these are just a selection of some of the videos that they produce quite regularly. So you've got patient videos there, you've also got interviews with heart consultants, some educational videos they do as well, and plus they do a lot of exercise videos they'll post on there, so they can show people how to different exercise and how they can get back to health through doing that. So the final video I'm going to show you is, this is quite an interesting one. This is around multiple sclerosis, and this is a really, really active group that's set up, and it's been running about sort of 18 months, 2 years, but the conversations that go in there are quite interesting, and these are one of the areas that they often are prone to on the kind of organic sites from people coming in trying to sell them things. So when we set this up, we did originally have quite a few people wanting to join, and then we're trying to sell them different kind of mobility equipment and things like that. So they had to do a bit of policing at the start to make sure the people that were joining were MS patients, and it was for the right reason.
I'm Nikki Embry and I'm one of the clinical nurse specialists in MS at the Royal Stoke MS Centre. I've worked here for 20 years as an MS specialist nurse, and Facebook was something that I thought might work well with some of our MS patients. So the group was set up about 18 months or so ago, and it is going exceptionally well. We have almost 250 patients now that have joined the group, and it's worked well because it's a private forum for patients to gain information if they want to, but more so because patients have found such a lot of benefit from chatting to one another in this closed forum. It is open to family members if they wish to, so we do get some questions from carers of people with MS, but people with MS say that they like chatting to other people who have MS and understand what they're living with. Some questions they will direct to the MS nurse, but to be honest, I am probably going on 2 or 3 times a week at the moment just to monitor, to look at some of the comments that have been put out, and it seems to be running itself. Someone will perhaps ask a question about a symptom of MS, say pain for example, and we're getting more than 15 comments on each of these questions, so people are providing them with really useful information. It's educational, it's really supportive for the patients, and from a nurse's point of view, I am quite convinced that it's reducing the number of telephone calls that we have from patients. We might have got a phone call about side effects associated to a certain medication, or sometimes patients just do like to ring and have a chat, and for confidence purposes sometimes if they're lacking a little bit. So patients aren't tending to do that as much. They're using that forum to get their information from, and because the people on the Facebook group know what they're living with, they're getting really good empathetic comments back. I thought we would get quite a few problems with it, knowing that there have been problems with Facebook before, but because this is a closed group, it's a private group, and people are invited to join it, we've had very few problems. Facebook's provided a really good forum for people with MS to share positive thoughts, positive comments, to share ideas, and to recognise the importance of education and information, not only for newly diagnosed patients, but for patients right throughout the MS disease trajectory.
There is another group on Facebook I used to be a member of, and it was just the general public, really. It wasn't regulated. It wasn't run by any nurses. It was just the public, and I found that the information on there it could be quite slightly misleading. And I thought, is this the truth? Because I didn't know at the time, so I don't use that group anymore. I do only use the Facebook group that is set up by the nurses. They read it, they can look at the answers and make sure it is correct. So I really found that group useful. It's really good. Yeah, I mean on this Facebook group, yeah, you know that the information you're going to get is correct, but you can always make contact with other people, so you can have conversations. I mean, I've actually grown pretty close to a couple of people on the group. And we talk a lot. We haven't actually met yet, but we do talk a lot, and we ask questions and answer questions if needed. And it's just someone there to listen to you. So someone, if you've got a problem or anything, and it's, I don't know, you're thinking, oh, is this a relapse or something? Just for example, you can ask the question and you can get the advice. I haven't asked a question for a while because everything's going smoothly for me at the moment with my MS. So, but I do read it. I do generally log on to Facebook every day, actually. Bit of a Facebook person. But yeah, it's just so easy to use. It's just so easy to click on the group and actually just read the comments, just see what's going on. So that really helps me, because it's people in the same boat. Yes, I use my tablet and my mobile phone. So yes. So I'm always on. If I'm not at work, I'm always on something. Technology, love it. Because there is some patients. We all actually go to the hospital to have our drug treatment at the same time, and we are really, really close now because we meet every 28 days. We'll sit there having our Thai and we have cups of tea and cake and sandwiches, and we just have a good natter. It's like a couple of hours where you can just sit down, relax, and just talk to your friends, because we are close friends now, and we talk to each other outside of Facebook as well. So it's always nice.
So just in terms of some key considerations, obviously, the equipment and consent. One of the comments made earlier around access to staff to use social media, things like that have to be agreed with senior leadership within the trust. The governance processes we use for this are very similar to what we've been using with Skype. So it's been clinically led. So things like privacy impact assessments and all those sorts of things that you make sure you've got underpinning the programme. But once you've got a lot of that, and plus you've got the clear boundaries, so the patients are aware of what they can and can't do through the groups, and we do get a lot of it where people are referred to ring the clinic or to email them on specific things. And we've also, it's important you get a lot of training and various different toolkits we can provide for staff But again, once the staff are educated in using it and they feel confident in using it, then a lot of the ideas come from themselves. And these are just what we're doing on the next step. So we're about to start a similar project at Walsall Hospital around respiratory clinics. So that's kind of the next one. And we're also just about to start Parkinson's disease and dementia support as well. So we're getting a lot of interest in that, as well as epilepsy support. And then just at the bottom, this was something that's come out of the staff. They want to have some Q&A, live Q&A discussions around things like medication. And things like in MS, it would be managing pain and things like that. So we're going to be, early in the new year, we'll be using Facebook Live for that as well. So that's an exciting development of how we're going to be using that. And that's that.
Thank you very much, Mark. Wasn't it great to hear the patients themselves telling us what they got out of being in social media channels like Facebook groups? Do we have any questions? There are a few on Slido. Anyone want to put their hand up for a question? Mark, you might need to come back. If you haven't used Slido before, by the way, if you look on your programme, it tells you the web addresses, and you just put the hashtag EngageWell in. And we've got the poll going. We've had 27 replies so far to the question we put out on Slido. We've got someone with a hand up, though, doing it the traditional way. Fantastic.
Sorry.
Hi, Mark. Obviously, I understand the closed Facebook groups manned by clinicians. I'm just wondering, have you had any issues from Facebook itself, obviously, with these people declaring that they've got health conditions, with any kind of like advertising or things being targeted at them?
No, no. As I mentioned earlier, the only thing we did have was in the MS group. We had a couple of people that asked to join the group, and the difficulty is some of them manage it slightly differently. So the MS one is a little bit tighter now, but they would get a request to join the group, and then the person would sit in the group, and you would assume they were an MS patient, and then they started posting links to products. And then we found that the products were, obviously they were part of the products. Similar to what you do get in the organic group. So there are, if you get, say, a weight management group that's been organically created, I've seen instances where there are people putting links to diet pills and different things like that. Well, you know, it's kind of, because they're being moderated by patients, they've not got the kind of, often the robust sort of backing behind them to deal with that. But in terms of the way the MS works now, they restrict it to people on their list, so that we've not had anything around advertising or any problems on that really. The only way it might develop as well, we're starting to look at the third sector and seeing whether the third sector can help with some of the input with the information, particularly on the dementia project I mentioned earlier. So that would be kind of, we'll probably get Dementia UK or something like that would be part of the group as well.